Primary healthcare really represents the first port of call for someone in the community looking for assistance for a problem. Traditionally, GPs have provided after hours for their own practices.
With help from Medicare Local, what we were able to do was to provide this service between 6 and 8 in the evening. And the idea of that is to provide a sort of an after hours service at a time when we thought people would particularly need it.
We used to just cover a set amount of patients for the doctors that worked in the practice, whereas now we're doing the trauma region.
The service is to try and provide GP care that people can access without having to use the resources of the emergency department.
Unfortunately, with emergency departments and there's no appointment system, and the most critical cases are dealt with first, there often can be very long waits. We run an appointment system, so we're really pretty much on time, which is great. So when they turn up, they are usually seen fairly promptly.
Probably the most important thing is the timeliness of their treatment, that they don't have to wait for long hours in an emergency department.
It can be irritating to have to sit there for 3 or 4 hours while you're waiting to be seen.
When we're using our after-hours service, I mean, really, it's very difficult for us to stand by ourselves. We do have a pharmacy that's open, which is fantastic. They're staying open the same hours as we are.
There was a need in the community, and with the help of Medicare Locals, we managed to get some services up and running in terms of providing the after-hours services to the patients. These services hasn't been available for a long time, and people are working longer hours. They're always looking for after-hours services.
A lot of patients that tend to present to emergency departments are category 4 and 5s, so it's more GP work. So it will free up the hospital, obviously, and the waiting times, and they get seen on the day.
The advantage of seeing a GP after hours for category 4-5 problems is that they're the kind of problems that GPs are used to treating, and often they're the sort of problems that doctors working in an emergency department, particularly training hospitals, don't have experience.
There are all sorts of reasons why people come to see a GP after hours.
There's a small number of people who just can't get to us during the normal hours.
Sick children is a common presentation after hours. Children with fevers, vomiting, ear infections, throat infections, as well as sick adults, gastroenteritis, chest infections.
A lot of elderly, we see people travelling through town.
There was a need, but now that there is a service available to fulfill that need. The most common healthcare provider as a pharmacy we refer is the GPs. And they are the usual, most commonly asked service which people are looking for when they come and see us.
And now that we have an extended hours service, I think it has been better for the patients.
I love after-hours service because it gives the community an option that's not either ED department where you're waiting for hours or the expense of maybe a private hospital.
So it does help a lot having an after-hour GP service or a pharmacy service.
I think we are performing a valuable service.